everyone, today's topic is vitamin C, that is otherwise called ascorbic acid. And what are the features of vitamin C? It acts as a reducing agent. It is an antioxidant vitamin. Okay, like vitamin E and vitamin A, this vitamin C is also an antioxidant vitamin, and this cannot be synthesized in humans. We will see why. Okay, so what are the different forms of ascorbic acid? One is ascorbic acid, the other one is dehydroascorbic acid. Why humans cannot synthesize vitamin C? Because we don't have an enzyme called L-gulonolactone oxidase. Okay, so when this enzyme is not present, this vitamin, okay, ascorbic acid, cannot be synthesized from glucose. Okay, because if you see these reactions, it requires the enzyme glucuronate reductase, gulonolactonase, and L-gulonolactone oxidase. Not only in humans, bats, guinea pigs, okay, they also don't have this enzyme L-gulonolactone oxidase. So primates, guinea pigs, and bats will not be able to synthesize vitamin C from glucose. All the other animals are capable of synthesizing vitamin C from glucose. So what are the dietary sources? Because we cannot synthesize this vitamin, we have to take this vitamin in the diet. So what are the rich sources of vitamin C? Okay, we all know, right? All the citrus fruits, this amla, guava, okay, and lime. So these are rich sources of vitamin C. Apart from that, cabbage, cauliflower, potato, orange. Yes, we left orange in the citrus fruit, right? Yes, so these are all rich sources of vitamin C. Okay, so what is the recommended daily allowance? For adults, it is 75 milligram per day. As usual, pregnancy and lactation requires more. It is 100 milligram per day. And infants, 20 milligram per day. And for children, it is 40 milligram per day. So, and what about the absorption? Vitamin C is a water-soluble vitamin, so it gets absorbed via active transport from the small intestine. And dehydroascorbic acid gets absorbed more rapidly than ascorbic acid. So what are functions of vitamin C? It plays a very important role in the formation of collagen, and it helps in healing of the wounds, and it plays an important role in the metabolism of iron, and it also has a role in immunity, and it is an antioxidant vitamin. So we will see these functions in detail. So there are a set of enzymes which require vitamin C as coenzyme. Those enzymes are called vitamin C dependent hydroxylases. So this is the list of hydroxylases which require vitamin C as coenzyme. Prolyl hydroxylase, lysyl hydroxylase, tryptophan hydroxylase, 7-alpha hydroxylase, para-hydroxyphenyl pyruvate hydroxylase. Apart from this, we have other set of enzymes like dopamine oxidase and the hydroxylase enzyme which are involved in the synthesis of steroid hormone, and aspartate hydroxylase and trimethyl lysine hydroxylase. So these are the list of enzymes which require vitamin C as coenzyme. You can remember overall as hydroxylases. Okay, hydroxylases require vitamin C. Yes, so we will see the functions of vitamin C in detail, how it helps in collagen formation. So we saw the first two enzymes, right? Prolyl hydroxylase and lysyl hydroxylase. So as the name indicates what it does. So what happens here is addition of hydroxyl group to the proline amino acid and the lysine amino acid. So the enzyme prolyl hydroxylase will add hydroxyl group to proline, and the enzyme lysyl hydroxylase will add hydroxyl group to lysine. So eventually what is formed? Hydroxyproline and hydroxylysine. Okay, so these two enzymes are dependent on vitamin C. So when proline and lysine are hydroxylated, it results in the formation of mature collagen from procollagen. Okay, so hydroxylation of proline and lysine will result in conversion of procollagen to mature collagen. Not only that, prolyl hydroxylase also helps in the formation of a protein called osteocalcin. Yes, osteobone. It is present inside the bone, especially in the osteoblast, right? This is the one which is going to retain the calcium in the bone. Yes, so this protein, okay, also require prolyl hydroxylase for its formation. Yes, so moving on to the other functions of vitamin C, in iron metabolism, it enhances the absorption of iron because vitamin C is a reducing agent, right? Yes, so it reduces ferric ion to ferrous ion. Okay, we all know only in the ferrous ion can get absorbed and transported into the intestinal cell. So when vitamin C is present in the diet, it converts the ferric ion to ferrous form. So it enhances the absorption of iron. So whenever vitamin C is deficient, it results in anemia because it results in vitamin C enhances the absorption of iron. So when vitamin C is not present, no iron, so no hemoglobin, so anemia. Okay, so what is the role of vitamin C in hemoglobin metabolism? Some amount of hemoglobin will be present in the form of methemoglobin, right? Yes, where iron will be present in the ferric state. Okay, so the methemoglobin is converted back to hemoglobin, where the iron in hemoglobin in the ferric state is converted to ferrous state. The same role. Okay, so methemoglobin is converted to hemoglobin with the help of vitamin C. And immune function, so it enhances phagocytosis. Okay, phagocytosis of bacteria, okay, or other organisms, and antibody formation. It enhances antibody formation. It helps in movement of neutrophils, neutrophil chemotaxis, and it enhances the complement levels. So by performing these functions, vitamin C ultimately enhances the immune function. What about the antioxidant property? While discussing vitamin E, we saw the cycle, right? Yes, how vitamin E and vitamin C helps in breaking the chain of formation of lipid peroxidation, right? Yes, the same picture. So what happens when a free radical is generated? Vitamin E has more hydroxyl group, so it donates the H plus ion. So the free radical is getting converted to less toxic form. So in that process, vitamin E is oxidized. So that oxidized vitamin E is regenerated with the help of vitamin C, that is ascorbic acid. So in that process, ascorbic acid is converted to dehydroascorbic acid, and the oxidized vitamin E is converted to reduced vitamin E. Okay, and this dehydroascorbic acid is converted back to ascorbic acid with the help of glutathione, right? Yes, so glutathione helps in regenerating ascorbic acid. This is how vitamin Z play a role as a chain breaking antioxidant. Okay, so what are the deficiency manifestations of vitamin C? We all know, right? Yes, scurvy. Yes, vitamin C deficiency manifestation is called scurvy. What happens? It has a main role in the formation and maturation of collagen. If that does not happen properly, what happens? Bleeding. Yes. So we'll start from oral cavity. What happens? There will be bleeding from the gum, and there will be swelling and pain of the gums. And because of the pain and the swelling of the gums and weakness of the gums, it results in loosening of the teeth. Okay, there will be hemorrhagic lesions within the oral cavity. So apart from oral cavity, the bleeding will be present in the subcutaneous layer also. So it will be present as petechiae, ecchymosis, hematoma. Okay, yes. So there will be internal bleeding, that is bleeding from the nose. Okay, melena, that is bleeding from the nose, is epistaxis. Okay, melena, that is blood in stool, and hematuria, blood in urine. So whenever there is vitamin C deficiency, there will be poor formation and maturation of collagen. It will result in a lack of rigidity of capillaries because that is formed by collagen. So it results in bleeding everywhere, internal bleeding, external bleeding, bleeding in the oral cavity. Yes, so we all know vitamin C is required for prolyl hydroxylase and lysyl hydroxylase activity. Only when the proline and lysine are hydroxylated, it results in the formation of collagen, mature collagen. Okay, so when collagen is immature because of the deficiency of vitamin C, we all know it is present in all the tissues, right? Collagen. So capillaries become very fragile. The blood vessels and capillaries become very fragile, so there will be bleeding. Okay, so the bleeding manifestations are when it is present in oral cavity, the gums will be bleeding. When there is subcutaneous bleeding, it will be seen as petechiae and ecchymosis. Okay, and there will be internal bleeding, epistaxis, bleeding from the nose, and blood in stool, that is melena, and hematuria, blood in urine. Apart from that, they may also present with bleeding into the joints. Okay, they'll be presenting with joint effusion, and the minute hemorrhages under the nails and in conjunctiva, those are called splinter hemorrhage. So the next features are bones and joints, because the bones will be very fragile, because we also saw it is required for the activation of osteocalcin. So the bones will be very fragile, so they are more prone for fracture, and the person will be presenting with bleeding into the joints, that is called heme arthrosis. Okay, bleeding into the joints, so that is called heme arthrosis. Okay, yes. So what happens next? Anemia, because vitamin C is required for the absorption of iron. their deficiency of vitamin C will result in deficient absorption of iron, which will result in anemia. The other cause is the person will be presenting with bleeding, right? Internal bleeding, subcutaneous bleeding. So because of the blood loss, there will be anemia. And because of the reduced iron absorption, there will be anemia. And there will be accumulation of met hemoglobin. Okay, the iron and hemoglobin will be in the ferric state. Okay, because of the accumulation of met hemoglobin, the person will be presenting with anemia. So these are the causes of development of anemia in case of vitamin C deficiency. So if you do the peripheral smear in this case, it will be microcytic hypochromic anemia. Okay, the RBCs will be very small and will be less colored. So microcytic hypochromic anemia. So what is Barlow's disease? Okay, in the weaning period from 6 months onwards, if the baby's diet is deficient of vitamin C, the baby will be presenting with the features of scurvy. That is called Barlow's disease. Infantile scurvy, the presentation will be between 6 to 12 months, because 6 months is where we used to wean the babies from breast milk to the other solid foods. So if the baby's diet is deficient in vitamin C, it will result in scurvy, and that scurvy, which is presented between 6 to 12 months of age, is called Barlow's disease. Okay, so what are the therapeutic applications of vitamin C? Because we know it is required for wound healing, right? Yes, so it promotes wound healing. So it is given in case of burns and ulcer, and it is also, it has immunity enhancing function. So it enhances the immune function. So it is used in infections like tuberculosis. So these are the therapeutic functions of vitamin C. So that's all about vitamin C. So we saw why humans cannot synthesize vitamin C, and what are the dietary sources of vitamin C, and what are the functions of vitamin C, and what are the clinical features of scurvy. And apart from that, what are the deficiency manifestations of vitamin C, like anemia. Okay, so this is all about vitamin C. Thank you.